And without further ado, now I want to introduce our hostess, the creator of this incredible organization, and somebody who is so very valuable to our Hispanic community that I'm very proud to know and to have known for several years and to admire her work. Is Dr. Yanira Cruz, the President of the National Hispanic Council on Aging.
Muy buenos días. Good morning. I hope you're enjoying the summit in beautiful Washington, D.C. Thank you for being here. It's really my honor to be here today to collectively develop strategies that ensure a brighter future for our Hispanic older adults, families, and caregivers, and indeed our nation. Over the last 2 days, we've shared best practices, tools, and resources with grassroots, grass-top leaders from across the country. And two very interesting labels came out of that discussion over the last 2 days, which I'd like to share with you. One is the assets that our older adults bring to our communities and to our society, and how rich we are with those assets, and that we ought to lift those up. The second label that comes up a lot and throughout the conversations we've had in the last 2 days is the loyal voters that we have in the older adult population. So wanted to share that with you, that those were very important themes that came out of the discussion. And so we're here today. Today we will expand on the issues of most impact to Latino seniors and families by offering thoughtful solutions and ideas that will strengthen the national discourse on Latino aging issues. First, I'd like to talk about some of the challenges we are facing as a community and why we must move forward together as a nation to address them. It doesn't matter where you're from or what you do for a living. The job situation is the biggest issue on people's minds these days. We hear about unemployment crisis in the news, on the streets, and in our homes. Official numbers indicate the unemployment in the Hispanic community at 11%, 2 percentage points higher than the rest of the population. And this number is likely to be higher as a result of underemployment. It goes without saying that jobs are indeed important, but it isn't the only ingredient toward creating a bright future and better outcomes for our communities. We have other factors, like access to quality health care so we can live the best possible health, the ability to build wealth so we can be economically secure, and access to quality housing so we can age with dignity with our families and in our communities. As a nation and as families and individuals, we can make these factors a reality. First, though, we need to understand the barriers that make them currently unattainable, while creating awareness so we can map out a path that is both effective and impacts the social consciousness. Today, the scope of our discussion is focused on 3 important issues: health, economic security, and voting trends. I will also share with you some insight gained from this year's Promoting Communities of Success regional meetings to take a pulse of the needs and concerns of Latino seniors and their families and caregivers in their respective regions. In terms of health, Hispanic, especially Latino seniors, continue to face significant inequities. Although Hispanics comprise 15% of the US population, we represent 19% of new HIV/AIDS cases. And as the infection rate of HIV/AIDS rises among all older adults nationwide, Hispanic older adults are excessively affected. Latino seniors are also twice as likely as non-Hispanic whites to suffer from diabetes, and more likely to suffer from its complications. In general, about 80% of Hispanic older adults suffer from at least one chronic condition. Now, that's the bad news. The good news is that many chronic conditions, including HIV and diabetes, are preventable through healthy living. But in 2009, more than 1/3 of our community lacked health insurance, which limited access to prevention services and wellness services that prevent serious problems from developing. Despite the fact that we have Latino seniors who are insured, a lack of cultural competency or linguistic gaps makes healthcare providers' visits frustrating and unfruitful, and often keeps older adults from preventing and controlling their chronic conditions. And this situation has got to stop and has got to change. And we can make the same observations about Medicare fraud, a crime that is highly perpetrated in the Hispanic community. The reason why our elders are especially vulnerable is because they often don't know how to recognize it or report it. In the area of economic security, the Hispanic community, which is already vulnerable, was among the hardest hit communities by the recession. In terms of Latino elders, the poverty rate is currently at a shocking 18%, compared to about 8% for non-Hispanic white seniors. What is even more troubling is that without Social Security, that percentage would rise to almost 50%. This means many of our Latino seniors are charging their daily needs on credit cards or having to prioritize their basic necessities. Should I put food on the table or should I buy my medications? It also means that many of our elders face the uncertainty of being able to afford their housing on a monthly basis. And perhaps quality housing for Hispanics has been hit the hardest. Today, 50% of Latinos rent their homes, a figure that has likely been rising since 2008. And 10% of Hispanics report to live in overcrowded conditions. To give a real face to these issues, at our regional meeting in Los Angeles just a few weeks ago, I was approached by a Hispanic older adult who told me she receives $680 from Social Security. With this check, her sole source of income, she pays $500 for rent, $100 for utilities, and that leaves her with just $80 in her monthly for food, medication, clothing, transportation. While these challenges are undeniable, I am reminded of the saying, in every dark cloud, there's a silver lining. And times of crisis can surely turn into moments of unique opportunity. Today, we stand at the cusp of one such opportunity, and we must take advantage of it. Difficult times present a unique chance for us to, as a nation, to unite, reevaluate our priorities, change directions, and plant a course toward a better, brighter, and prosperous future. And the Hispanic community is poised to answer the call to action. Why? The first reason is demographics. The Hispanic community as a whole is projected to grow by 30% by the year 2050. And by 2019, the Latino senior population will become the largest non-white elder population in the United States. These demographics represent a large and potentially powerful voting bloc of 21 million voters. Each year, the Hispanic community adds 500,000 voters. Two out of these voters reside in 4 key battleground states: Texas, California, Florida, and New York. Hispanic older adults make up a significant part of that voting bloc. Despite representing only 12% of registered Latino voters, older adults are the most likely to vote. In 2010, 58% of Hispanic older adults age 65 and older were committed to voting before the elections. Secondly, we also have economic clout. In 2011, the Hispanic purchasing power was $1 trillion, and it continues to grow. By 2015, Hispanic purchasing power is expected to reach $1.3 trillion. Thirdly, we are poised to take on a greater share of the nation's future workforce. As the general US population ages, the workforce will be increasingly comprised of Hispanics, who will represent 18% of the workforce by the year 2018, an increase of 33%. By any measure, there's no doubt that our community matters. But none of these figures and statistics will make a difference if we're not prepared to take the wheel with a planned course of action, and that process starts today. Before we continue, I'd like to share a general outline describing what we need to do to achieve the ultimate goal of helping our communities and country grow and prosper. First and foremost, we have to vote knowledgeably. This means understanding the issues and the candidates and making educated decisions. NHCOA is taking a principal role in leading Hispanic community dialogue on key issues and providing information. Second, we need to mobilize our communities around the issues that matter to us through civic engagement and leadership development. For this reason, NHCOA has made it a top priority to provide training in leadership and civic engagement to Hispanic older adults and their caregivers across the country. Third, we must continue to help our communities overcome health, economic security, and housing challenges through education, advocacy, and outreach that is culturally competent, linguistically appropriate, and age-sensitive. Some of this work will present unprecedented challenges, but we need to continue to press forward because if we don't speak out, someone else will. NHCOA's work to preserve key programs is an example of unprecedented challenges. We now find ourselves defending programs that were once considered safe from cuts. We're also defending American values that were once considered shared principles, such as helping those most in need, ensuring opportunity for all, and providing economic security for our seniors. As the budget debates continue to heat up, we will find ourselves debating these values. We urge the President and Congress to defend these values, as these are the very principles that make the U.S. the great nation it is. NHCOA is as committed as ever to leading this charge. As we traveled across the country, hosting regional meetings to promote communities of success, what we heard over and over again from people we represent on a daily basis was, what can we do to protect our seniors and make this country better? What we learned was that Hispanic older adults, family members, and caregivers around the nation are aware of the challenges they face, and this energizes them to do something about it. They also spoke about their top legislative concerns. The biggest concern was protecting and strengthening senior federal programs, Medicare, Medicaid, Social Security. Seniors were concerned about Social Security beneficiaries not receiving a cost of living increase or COLA. They also were concerned about protecting and improving the Older Americans Act to ensure that the Act and the services provide services to all diverse elderly. The third top issue was federal assistance for grandparents raising grandchildren, as many of them are bravely struggling to raise their grandchildren on fixed incomes and not in the best of health. And since they often don't have legal guardianship, they are ineligible for available assistance. So that brings us to this moment, here, today. Together, we can address all of these challenges, and we are taking the first step now. This is the moment our community has been waiting for. This is the moment for us to lead the way in our respective capacities to improve the experience of aging for all elders. And in this process, let us remember that a society that is better for older adults is a society that is better for people of all ages. This is the moment for us to stand shoulder to shoulder with decision makers from all over this great nation to look past the storm and set our sights on a brighter tomorrow. This is the moment to work together to create a stronger Golden America. Who is up for this challenge? Who will join us? Thank you for being here.